One of the challenges that we face here is members who are not interested in this program at all. Members who aren't interested in taking care of themselves, aren't taking responsibility for themselves. And those are the people that we want to find a way to connect with them. Impacting the health of our members is important because overall we are not a very healthy organization. We work 6 days a week, we work very long hours. Our members have a limited time to be with their children and families, and they could do a much better job taking care of themselves. What we've done is we worked with the Way and Win staff to create a short video which explains to our membership what the Way and Win program is, how it works.
I'm here with Erin to talk about the resources we offer to get you healthy.
And we use that video to introduce Way and Win to our membership. We also partnered with Kaiser Permanente, who helped us get activity trackers to give out to our members. This coming year we're going to have a portable kiosk which we will transport around the district. We will take it to a different location 1 day a week for the next couple of months. We've come a long way, but we also have a long way to go.
A healthy community is a happy community. Wellness is a big part of the City of Brush, and the recreation program we have helps maintain that.
Vicki Quinlan, who is one of our City Council members, contacted me and was excitedly telling me about this program of Way and Win.
I was contacted by Way and Win, and I think one thing that helped get the kiosk out here in Brush was that I told them I was on the advisory for Healthy Eating, Active Living, the HEAL program, and that I believe convinced them of our commitment to putting the kiosk here in Brush.
Way and Win has been a great success for our community. Our local newspaper helps keep the idea and the reminders fresh to our community. We're proud that we have 10% of our population using the kiosk actively. So it's really an opportunity for folks to get out and have a wellness exposure in the rural area of Colorado.
I'm 73 now, and I think when I was 70, I finally decided I need to be in charge of me. And so through Way and Win, its daily reminders help me remember the right things to eat, the importance of exercise.
I think every person has an individual responsibility for their own health. And so by bringing the kiosk into Brush, that helped the whole community, I think it can improve their quality of life.
Since I started with Way and Win, it isn't so much about the weight. It's those reminders to live life differently and therefore hopefully live life longer.
Part of our goal in Canyon City is to create a culture of wellness, not just programs that come and go. And Way and Win really, what I've seen from the administrative level, just creates a lot of excitement, a lot of accountability.
We have used Way and Win in all 13 schools in the 3 school districts, and we have all kinds of community partners. Way and Win just fits seamlessly with our culture of wellness in the school district, and along with a lot of the programs that we were already doing, we just were able to integrate Way and Win right along with them.
I feel like our school district is very big into health and wellness, both within our staff and our students. We promote that throughout our district. One of the things I like is that it's really good for people who are not really quite sure how to eat right, what kind of exercises to do. It's definitely great that it's free. And it just gives them an idea of how to be healthy and how to start that process.
I'm actually transitioning out of my role as Regional Wellness Coordinator in Fremont County, and Brian Van Iwarden is going to take over as coordinator, and we have actually purchased 20 wireless scales that our hope is that one will go into each school building,
I hope that we can build on the success that we've had, continue to nurture relationships with the community, and then expand our accessibility by getting the wireless kiosks to all the schools and other locations throughout the community. Right now, traditionally, we've had a large number of females participate, so we hope to get more males. By introducing these out to the community, we hope then that we'll get more things like fire stations, police departments, where they traditionally have a bigger male influence. You get more people that are holding themselves accountable, then the stronger the program will be.
Well, I feel better, and my clothes fit better, and I looked good at my daughter's wedding this summer.
Well, I've always been a fitness advocate. I was an athlete in college, and the one thing that I saw around this community that wasn't commonly available were effective weight loss programs. Initially, it was contact with the Weigh and Win staff and learning the procedure, the process, whatever, for getting it in place. And then going through local city government, pursuing the options for funding. So I wrote several grant requests that were obviously successful, and here we are. I think we've been installed now for about 2.5 years.
I retired and moved to Boulder County, and there were lots of options, and this one right here was very convenient for me. The incentive to have the check, the quarterly check if you make your goals, and then it's something fun about coming to weigh myself, you know, get on the scale, aim the little camera, and I just knew that would motivate me if I had that to look forward to.
Well, it was very encouraging because the sincerity with which she wrote her story came right through in the write-up, so I was elated, I guess the word is when I read that and saw the potential it had for promoting the program.
And I like going to the site with the dashboard, and I can look back at the photographs that they've taken, and there's even a chart where I can see just that kind of steady downward mark. So I'm going to stick with it.
Well, it's more of a personal thing because, you know, I'm not out for any awards and, you know, pats on the back or anything like that. If it's good for the community, and it certainly is, then that's all the reward I need.
We've always had a commitment for a century for community health improvement. That's what our work is. And so when the opportunity to put the kiosk in the hospital came forward, the hospital said, yes, let's do it.
We use the kiosk, and we let the associates pick what text messages and emails they might want based on what challenges we're doing. So if we've got a physical challenge, they can jump in there and pick maybe more physical-based email reminders or text message reminders.
I heard about it through email through work from the Destination Wellness. They put out all these tips to us for different things, and I came and checked it out, and it's been positive, and I'm glad I did it. And it's just nice and convenient, and the hospital's really good about having it here and all the other things that they have to support everything.
All the wellness initiatives we have in place is really to help the people that come to our facility, whether they work here or they're here visiting, to have a healthier lifestyle. And we're trying to promote that and make it an environment to where it helps support their weight loss efforts, their healthy living efforts. And so that really helps tie into the Weigh and Win, because we've got a lot of staff here that use that and are using that to try to lose weight. And so we're helping support that environment by giving them healthy options of things they can choose from.
Improving community health can never be done alone. I mean, never be done alone. We've always done it in collaboration with others. At the system level, we're part of SCL Health, and they are committed to really making sure we're improving the health of our community, not only for the employees in our system, but also for that broader community. So collaboration is key to our work.
It's really helped me to be able to do things that I wasn't able to do before. I have grandchildren, and I want to be able to go roam in the park with them and play badminton and go for walks with my husband at night. So this has been able to give me that option to do all of that.
I have lived in Rifle my entire life. I have faced the challenge of not having access to care. So when I chose my career with Mountain Family, I got to make a difference in our community because getting access to care here is near to impossible.
It is very nice that we can have this integrated care where we don't just focus on a patient's mouth, but we focus on a patient's body. Everything is connected in our body, so we encourage our patients, to be able to see the medical department, the behavioral health, and it's really nice that we have everything in one office.
When I started Mountain Family in 2015, I had just graduated college. I was not eating healthy, so I weighed almost 210 pounds when I started this program. I got down to 165. This program kind of helped me, and being the spokesperson kind of helped, because I'm like, I can't speak to this program and not live it, right?
I started using it back again this year, and I was using it and sharing it with my daughter. We had a goal that we wanted to lose weight and be healthier. Between the both of us, we lost almost 60 pounds in 6 months.
It's not necessarily the weight loss, it's the enrollment in the program, because it matters that people are at least looking at it. I know with myself, the weight loss, it goes up and down. So being that I stay in the program, I'm aware, I think that is the most successful part of the program for us.